Hello and welcome back to the Pediatric Neuromuscular Care Seminar. I would now like to introduce our next speaker, Kelly Bell, who will be presenting on the importance of nutrition in children with neuromuscular disease. Kelly Bell is a clinical dietitian who joined Nemours Children's Health in 2018. She works with a neonatal and pediatric intensive care patients to provide nutritional health assessments and also serves as the neuromuscular dietitian for the Muscular Dystrophy Association Clinic at Nemours Children's. Kelly is an adjunct professor of nutrition at Valencia College. Prior to coming to Nemours, Kelly was the nutrition services manager for BI at Greyhawk, a 90-bed long-term care facility, and gained experience in pediatric nutrition through Cardon's Children's Hospital and Phoenix Children's Hospital. Kelly spent time working with malnourished children as part of her dietetic internship in Tanzania, Africa. She also served as the community relations director and exercise therapist at BackFit Health and Spine. Kelly earned her Bachelor's of Science in Kinesiology and Wellness Development at Pennsylvania State University before completing her Master's of Science in Nutrition and Dietetics at Arizona State University. Kelly is a member of the Academy of Nutrition and Dietetics as well. Thank you so much for joining us today, Kelly, and I will go ahead and pass it off to you.
Well, thank you very much. Thank you for having me today. I'm going to go ahead and share my screen with everybody. Well, thank you. Yes, my name is Kelly Bell. I'm with Nemours Children's Health System, and I am very happy and honored to be with the MDA today to talk about the importance of nutrition in children with neuromuscular diseases. So thank you all for attending, and any questions at the end are absolutely welcome. So really, when we think about nutrition, it's important for all of us. Nutrition is something that can really help keep our health going the way we want it to go. So with neuromuscular conditions in particular, this is very important, especially in our childhood years, because we want to make sure that we're growing appropriately. So nutrition is something that's going to help optimize, maximize the growth potential that we do have in our children. It also helps us to prepare and create that foundation for the adulthood years. So that's our goal. As we're parents raising our kids, we want our children to have the best that they can have so they can make it to their adulthood with having a good quality of life. And the big part of this is having a good balance in their weight. A lot of times when I'm meeting my families for the first time, I'm explaining my role with our whole care team. And really it's about making sure that we're reaching those growth potentials. We're not gaining weight faster than we are growing long-wise. We're not carrying too much weight, but on the other end, we don't want to be too underweight either. So we really want to get that balance going on. And of course, we want to optimize every physiological function. So nutrition is going to help give us that backing and strength for treatment plans that we're on. There's a lot of new treatment options out there for many of our different neuromuscular conditions. So we want to make sure that nutrition is helping to support that, not hinder that. We also want to make sure that we have the right nutrition if and when our child gets ill. We don't want that to happen. You know, especially in today's world, we are really taking a lot of precautions. But if some sort of illness does strike, we want to make sure that we have the right nutrition so we can recover from that and get back to a better place with that. So how do we think about doing that? If we're thinking about nutrition, it really starts from the ground up. In our infancy, at this point in time, your child may or may not have been diagnosed with the neuromuscular condition. So it just depends on which type it is, what kind is out there. We now have some newborn screening that is showing us that our child is carrying or has the potential of having some sort of neuromuscular condition. So in the infancy years, we want to make sure that we are achieving our growth goals. And this is a time in our life when there's rapid growth. So we want to make sure that we're getting that nutrition into the body and achieving and meeting those growth goals. We're also developing our feeding skills, and this travels into those toddler years too. We don't think about it very much when we are eating, but it's actually a muscle activity. So certain neuromuscular conditions might have some difficulties with achieving those feeding skills and learning those feeding skills. So we want to make sure that we're getting our nutrition into our body again, especially if there's anything that might be impeding on those feeding skills. And of course, in our toddler years and our childhood years, there's a little bit of a fear factor with food. Now, it's not the worst thing ever that kids are like this. They're not going in the backyard and eating something that they shouldn't eat, but we also want to make sure that we're encouraging them to try new foods, and that could be, well, not could be, it almost always is a very frustrating experience and journey in trying to get kids to try some of these new foods. So we want to make sure that we're okay with that. And we could have some tolerance issues to some of our foods. Again, it depends on the neuromuscular condition and how we're getting nutrition into our body, but there might be some things in our digestive system that just aren't letting the food get into the body, or it's not going through very easily. So if we have some hangups there, then we have to start addressing that and figuring out what to do with it. And of course, as we get older into that adolescence time period in our life, we're still growing. So even though growth has slowed down, we still want to make sure that we're getting that balance of body weight in there and making sure we're meeting all of our nutrition needs. And then of course, we're really watching bone health. This is something that oftentimes my parents are surprised that the dietitian is focusing on. But really our muscles, every muscle in our body attaches into our bones. And so muscles really do two things. It's contracting, tightening up, and relaxing. Those are the two actions that our muscles do. And when they tighten up, they pull at the bone that they're inserted into. And that kind of stimulates that bone to start growing. So if we have a neuromuscular condition, our child with that neuromuscular condition not going to have that same stimulus on the bone. And we want to make sure that we're getting those bones nice and strong. We don't want to have weaker bones and then risk of fracture. So first and foremost, your dietitian is going to make sure we're getting those bone building nutrients into our body. And then we start to monitor to make sure those nutrients are going into the bone appropriately so. And we might have to get some other members of our care team involved to help get that bone health going where we want it to go. So as we're watching this through the lifespan, we're going to be looking at these growth charts. And the growth chart, I'm going to pretend that no one has ever explained it to you. So with this is an example of a growth chart here from 2 years to 20 years of age. And our goal is that you fit somewhere on the lines here. Now for many of our neuromuscular conditions, they're rare enough that there isn't a specific growth chart lined up for that neuromuscular condition. So we still compare it to our CDC, Centers for Disease Control growth chart. And the goal is still to make sure we're somewhere on the lines. That's based on the genes that we're given, and nutrition impacts that as well. And we want to see that we pick one of the lines or in between the lines, and we kind of follow through the wave here. Now, again, it depends on the treatment plan. It depends on the neuromuscular condition where we may or may not follow along that line. For example, in some of our neuromuscular conditions like Duchenne, where we may have some steroid treatment, our linear growth, us growing longwise, gets compromised, and so we might start to see that kind of slow down a bit. But that's one of the things your dietitian will be monitoring to make sure we're still meeting growth goals, and if we're not, we may again have to get some other health team members involved to help promote the best balance that we can get. So some of the goals that we're looking for all of us, we all have to eat, is to make sure that we're getting the right balance of nutrition. Even if it's a good nutrient, there is still a such thing as having too much. Nutrition is really all about balance, not having too little, not having too much. The number one question I get when I meet my families is, what kind of supplement can I take? Is there something out there that I can do in addition to food to really maximize the quality of life and the chances for my child? The reality is there's not strong evidence for any of the neuromuscular conditions that I've come across where there's any particular types of supplements. We'll continue talking about some nutrients that we really focus on where there might be some individualized cases where supplementation is appropriate, but nothing off the bat where we say, oh, you got diagnosed with this name of a condition, here's what you have to take. Really, we want to make sure you're getting enough nutrition and that balance is in there to promote meeting those growth goals and getting enough calories, not too many where we're gaining weight too quickly, not too little where we're struggling to gain weight. There can be some implications and some problems if we're over or underweight, so we still want to get that balance in there. And this is very individualized. Certain conditions, we might have some patterns and some knowledge that we're looking for, but really every person is going to have a slightly different nutrition plan that goes along with it. And we want to think about what happens when we get sick. Now, we're taking great precaution, and I love that. We want to keep doing that, but really kids tend to get sick. And when we don't feel well, we don't eat well. So we always want to make sure that we have some sort of plan in place to get at least a little bit of nutrition to bridge this gap while our body is fighting off whatever pathogen we have. We also want to try to prevent long-term sicknesses, especially for those kids who might have cardiovascular risks. We want to make sure we're getting the right nutrition into our body so that we can promote a good quality of life and keep those organs nice and healthy as long as they can be. And again, that's something we all benefit from when we make good, healthy nutrition choices. And of course, bone health, we're watching to make sure our bones are staying nice and strong throughout the lifetime. And bones are really building during our childhood years. It's much more difficult in the adult years to really get those bones nice and strong. So we really want to try and optimize that during those pediatric years. So some of the things we're going to focus on when we're having our clinic visits is checking our nutrition. First and foremost, we're checking how you're growing. So anthropometrics is just a fancy word for measurements. We're going to check your weight. We're going to check your height. In our clinics, we do this diligently. If it's been a minute since your wheelchair has been checked and weighed, we're going to take you out of that wheelchair. We're going to weigh you. We want to try, if you're a younger child, we want to make sure that we have any kind of clothing that could be weighing you down, diapers that could be weighing you down. We want to make sure those things aren't going to be part of that weight. We really want to know from visit to visit, how well are we growing? Are we gaining weight too fast, too slow? What is happening with our growth? Same thing with linear growth. Are we getting taller appropriately based upon our age and based upon our condition as well? So are we meeting those growth markers and goals? Really watching that and checking to see what's going on, especially if we're starting new treatment plans. Some of our treatment plans might increase our appetite. Sometimes they can impact how we're taking our nutrition, how we're utilizing our nutrition as well. So we want to focus on those things. There's something that we do with our physical exams. We're checking to see, do we look well nourished? A lot of times I'm with my families, the children are playing. They don't necessarily know that I'm looking at their nails, their eyes, their mouth, their gums, their teeth, their tongue, to see, does everything look like it's intact, or do we see any physical signs of nutrition deficiencies that we might have to address and check through different things there. Of course, we want that balance. Too much or too little of nutrition can be a bad thing. So we want that balance. We're going to focus on checking labs. It might be certain labs that we want to check, or maybe I took a look at the physical body and something looked off, and now it's time to check a lab and see what's going on the inside. We'll talk about what we're eating so that we can check and see, is there anything else that we have to look further into? And again, that bone health. A lot of our conditions, especially if we're not able to walk and bear weight, we're going to be checking to see how your bones look. So ways of doing that is at least annually checking for a vitamin D lab to see what our vitamin D levels look like. We might have to supplement with vitamin D. First and foremost, we want to check the labs and see what kind of levels our body is already storing at that moment. So that's going to help us to see, do we have the right nutrition in place to keep those bones nice and strong? We also do some DEXA scans. These are ways of actually checking to see how strong your bones look. And if they're going to be on the weaker side, do we want to get some other levels of care involved, like an endocrinologist, to be able to help keep those bones strong? Benefit with the DEXA scan as well, it can give us a body composition. It's limited if your child has any kind of spinal rods, any metal like that. Sometimes we can't pick up some of the information, but in many cases, we can get the body composition. We can see how much percent the body is of fat tissue versus lean tissue. And we can watch that over time. If we do this once a year and we're checking, we can watch and see how that's changing over time as well to get a full picture of what's going on with the nutrition in our body and how we're storing it, how we're growing with it, and what do we have to do to keep moving forward. So some of the things that we really focus on is trying to be proactive and preventative with some of the things that can be precautions we have to watch out for. And first and foremost, weight maintenance is a big one. Making sure that we're not going into the overweight zones and making sure that we're not underweight either. Both can have some negative effects to it. So we want to keep us in that balance. So for your younger children, soon as we find out there's a neuromuscular condition going on, and if we're still able to eat by mouth, we want to get some consistency going on. This actually benefits everyone in the house. We can get some sort of pattern. If we are making sure that we're eating something, our growing bodies are eating something every 2 to 4 hours, meaning we're having 3 meals a day, 1 snack in between there, depending on the schedule and our nutrition needs. We can have somewhere between 1 to 3 small snacks in there. We want to try and keep at least 2 hours off of eating, and we want to make sure we're not going more than 4 hours apart from eating so that we can keep giving that opportunity for fueling the body and giving our growing children some nutrition. Now, as we get older, we might not have as much activity ability, and that means our nutrition needs are going to go down, especially our caloric intake. So we don't want to take in more calories than we have the ability to burn through different means of exercise and movement. So that might start to turn into having 3 to 5 small meals, not large plates of food, but just a small meal throughout the day to, again, keep fueling our body, but not overdoing it, finding that appropriate balance. We certainly want to avoid grazing. This is something that benefits every child. Again, we want to try to make sure that we're having that one small snack, tides us over, curbs our hunger until that next meal, but we're not grazing. We're grazing if we're just kind of eating food throughout the day whenever we feel like it. It doesn't allow us to really truly feel when we're hungry, and we sometimes lose that focus on our food, so we miss the point when we feel satisfied and full. And any child that's on any treatment options that are increasing their appetite, especially those that take steroid medications, appetite can go up where it's difficult to feel that sensation of I'm full, I'm no longer hungry. We would have some very big challenges if we're grazing throughout the day. So keeping that schedule is very important, particularly for our Duchenne population. If we know they're about to go on a steroid, even if they have not done so yet, I'm counseling the parents and working with our children so that we create this schedule first and foremost to make that expectation known so that if they feel that side effect of increased hunger in starting that steroid therapy, we already have that pattern, that expectation's already there. So we already know this is our schedule. If I feel hungry between that, we're gonna wait until it's time to eat. And of course, we want to make sure in that schedule, we're keeping our bedtime routine consistent as well. Sleep is incredibly important for that quality of health. And if we're noticing we're having trouble with sleeping, that's the time to work with the pulmonology team to make sure that we don't need other breathing support at night. We want to make sure we're getting good quality of sleep. That's the time that our body's using our nutrition to keep us healthy and growing well. So if we're thinking about our neuromuscular kiddos who are eating by mouth, we want to set the stage for a good, healthy plate. And again, this is something that can benefit all of us. So we want to have that good, healthy plate. And you notice on this plate, it's not too big, not too small. Half of our plate is going to have fruits and vegetables. Depending on the meal, it might be all of our non-starchy vegetables on half of that plate. We want to make sure that we're making room for some of these low-calorie foods. They're also very high in fiber and full of nutrition. A lot of vitamins and minerals can be found in these foods. Now, if you have some of the younger kids who are in that fear factor stage, it might not be their favorite food. But again, we want to make sure that it's on their plate. They have the opportunity to taste it and try it. We can't force them to eat it. All we can do is encourage them. Encourage, so that they can have the opportunity to taste it and try it. Of course, we want to include a little protein with that meal and a little bit of our carbohydrate foods or starchy foods. This could also be some starchy vegetables in there too, where we're giving just a little bit, but not going overboard where we're filling it up with the whole plate. Of course, a good low-calorie plain dairy is great calcium-rich food sources. You can also do fortified non-dairy. That's okay too. That's going to be fortified with calcium, and it's a great opportunity to get those bone-building nutrients in there. Now, if we have an underweight kiddo, we can do some of the higher whole milk products, but if we're noticing we're having trouble and we're gaining too much weight too quickly, that's when we want to do the reduced calorie. A little bit of heart-healthy fat is going to also be beneficial. This actually helps us to feel full just a little bit longer. For our kids who need some weight gain help, heart-healthy fats layered onto the food is a great way to calorie boost their food. If they need a little extra nutrition to gain weight, something like an avocado oil, grapeseed canola oil, they have no flavor to it. You can just sprinkle that on the food and give a little extra calories. If we're having trouble in gaining too much weight, we do want to watch how much we're using of these heart-healthy fats. Just a little bit goes a long way. A teaspoon is about 40 extra calories. But the nice thing is it can help you to feel full a little bit longer. And what it's also doing is these heart-healthy fats, we call them unsaturated fats, it can help your cholesterol levels go in the right direction so that you're going to have a better heart health in the long run. Now, for our younger kids especially, or any kid where we're having portion control challenges, we can use our hands as a good measuring tool way of doing this. So everyone's hand size is different, and as our hand grows, our portion gets to grow with it. But we can use some of these tips here to help portion out some of our foods on that healthy plate. As we're getting older and we might have lower calorie needs where we don't want to gain too much weight, we talked about having those 3 to 5 small meals. You can even cut this in half and just do smaller portions of that food to get a good taste for everything in there too. Now, of course, we might have that challenge of feeling hungry, so healthy snacks in between are very important, especially if we're going more than 4 hours apart of eating. We want to make sure that we're getting a good healthy snack in there. It's nothing too big. It's a great idea to do a fruit or a vegetable and pair it up with a small portion of protein. And that protein doesn't have to be a lot. It's just enough to give you a little bit of something in your body, and it actually helps you feeling full a little bit longer too. Now our kids, they love to have different things like chips and the Takis are big and popular right now. We do want to try to limit that. Always look at the food label, take a look at how many calories are offered, and offer a pre-portioned amount. Some of those foods, again, if we're eating by mouth, we can do once in a while. We don't want to restrict them completely, but we want to do more healthy options more often so that we have all this good nutrition in our growing bodies. So you can see some of these smaller protein portion sizes. These are about 7 to 8 grams of protein that get paired up with a fruit or a vegetable. So it stays a low-calorie snack. And again, if our kiddos need a little extra, we can throw in some extra calories in there too to give something else with it. But this gives it something so that we're fueling our body throughout the day. And here's some other examples for you too, of just a small snack idea. For those kiddos with the increased hunger, this can help curb their hunger. And that little bit of protein really helps to curb the hunger a lot. We also want to make sure we're drinking enough. We'll talk about that in a moment. But sometimes when we're underhydrated and we're not drinking enough, we don't always feel thirsty with that. Sometimes we feel hungry. So we want to make sure we're encouraging water intake as well. Now, if we're not getting enough nutrition, we could have the opposite problem. And here's the real big risk with not having enough nutrition. When we are going a long period of time without eating or fasting, our body starts to pull on our own stores for nutrition. And if we're fasting long enough, our body's going to start to break down muscle. Now, if we have a child with neuromuscular condition, we're not going to be able to rebuild that muscle very easily. So here's where a sick plan is very beneficial. Coming up with some sort of plan to give some sort of nutrition so that we have a little bit of something in there to help minimize any muscle breakdown from when we're not getting enough to eat. So this is something that we want to definitely make sure we are being proactive about discussing in your care plan visits so that we can figure out what do we do when our child doesn't feel well and can't eat very well. We also might have different means of eating because there could be a lot of gastrointestinal complications with our neuromuscular conditions. So some of these things create that barrier to taking nutrition in. A lot of times, because again, we don't think about it, we have all these muscles around our mouth, our face. Swallowing and chewing can be a challenge. This might start early on if we have some other of our neuromuscular conditions where we don't have that good feeding skill ability. It could happen later if muscles start to not work quite as well, and our child is starting to struggle with some of our swallowing and chewing abilities. Getting swallow studies the moment that we feel we're not quite eating very well is a very good idea. If we're not swallowing properly, it can go down the wrong way and get into the lungs, and then we have that higher risk of upper respiratory issues. So we don't want to have that. We want to make sure that we are getting that nutrition and it's going into the body. Otherwise, we can't use it if it's not actually going into the GI system the right way. A lot of our children with neuromuscular conditions, the muscles around that torso area not developing in a way that we can create enough space. And so now our stomach, if it gets too full, it competes for space with the lungs. We start to have some breathing issues, or we might have some challenges having that food in the stomach just empty out at a good pace. And so with that, we might start to have some intolerance with the food that we're eating. This can happen if we are doing our tube feedings or enteral feeds, or if we're eating by mouth, where it's just not leaving the stomach fast enough. So now it's going to start to come back up, or it's going to just stay there and compete with the lungs where we're having some breathing trouble. So we want to try to talk about these barriers early on as well, come up with those plans of if this happens, then what do we do? And of course, as our food is moving down our GI tract, what goes in is going to have to come out. So your dietitian on your care team is going to talk to you about bowel movements and how we are stooling and pooping. Every child is going to look surprised about this. We don't always like to talk about it, but this is a great conversation to have at home every day. We want to make sure our food is flowing through. So we want to make sure that we are having a bowel movement every day. Every other day might be the case, especially if we have lower calorie needs, but it's very common to see constipation issues with our neuromuscular conditions. We actually have muscles that are surrounding our intestinal wall, and they do a process called peristalsis. It's a muscular activity. Now, those muscles might be on the weaker side, but the muscles in our core torso area also stimulate those muscles. So if we are not able to move around very well, we might not have that same stimulus. So that's going to make it harder for the non-digested food to move through our bowels and have that bowel movement. So sometimes when we have these complications, we have to create some alternative ways of getting nutrition. The most important part is that we have the nutrition go into our GI tract and into our bodies. So when we have some of these barriers, we have to think about what can we do to try and compensate for it. This might be the time that we have to do some supplementing. We might have to take a multivitamin or specific nutrients based upon our needs. We might have to do some modifications to our food to safely swallow it so that it's easier to chew. We might also have to do some things where we are having some liquid nutrition. It might be easier to drink the food than it is to chew and eat it. Maybe a combination of all of those things. When we have lost that ability to chew and swallow, but the rest of our GI tract is still working, then we can do what's called enteral feeds. It's just a big fancy word for saying we're still using our intestinal system here. So we can do some short-term things where we do a nasogastric tube. It's just a rubber tube. We can actually still eat by mouth in some cases with this, but maybe we can't eat enough. Maybe we don't have enough muscular strength to eat all the calories that we need. This little tube can go down into the stomach or maybe even past the stomach into the intestinal wall and deliver some liquid nutrition to help us meet the rest of our needs, to continue giving us the nutrition that we need. If we know that we're going to need this long term, we might have to get a gastrostomy tube, G-tube for short. And this is something where we have our stomach right here in the middle. Instead of having that tube taped onto our face and having to worry about swallowing with it, we now know we're going to be using this long term. So we create a little pathway right through that skin there into the stomach so that we can deliver the liquid nutrition right through there. Now, parents, this is often a scary thought, and this could be all different types of ages as to when we're doing a G-tube if we need it. I've had many younger kids where they just couldn't get those feeding skills developed quickly enough, so we needed nutrition. We did a G-tube for several years, and then at some point we were able to not have to use it anymore. I've had children where as we got older, muscles just got a little weaker and we had to get that G-tube, and that helped us to get the nutrition in that we needed. Now, I will tell you, all of my parents and children who ended up getting it, they said, yes, I was more nervous about it, but after the fact, I'm glad I have it. This is especially helpful for a sick plan when we're not feeling well enough to eat, or if we can't take in that nutrition, we have that means of being able to get nutrition in there. And we have a good sick plan in place where we can give some enteral liquid nutrition as a backup plan. So there's alternative measures that we can do to help providing the nutrition. Bottom line, what we don't want is to miss those opportunities of receiving the nutrition that we need, especially with our children growing. They could miss that growing opportunity if they don't have the nutrition entering into their body. Now, again, if we're eating by mouth or enterally, we will make sure that we're having those bowel movements. So we want to look to make sure that we're pooping every day or every other day if we're not getting a lot to eat. This is a conversation that we definitely want to have with our children. It's funny to talk about for many of us, but it's also very important. Our bowel movements will tell us how our nutrition is being absorbed. So we want to take a look and talk about it. We want to try to have between type 3 or 4. It might be something where we see something pasty. It might be a little more formed. We certainly don't want to be straining and struggling with it. And we want to make sure that we have enough hydration and fiber to create that stool. A lot of our stool is going to be the fiber in our foods, our fruits, our vegetables, whole grains, legumes, beans. These are foods that have that fibrous component that our body doesn't have the means to break down. So it helps to create the bulk in our stool, and it also helps to just run through our body and keep us healthy. It helps to keep our cholesterol levels where it should be. So a lot of beneficial things happen when we have that fiber. The fiber stimulates some of that peristalsis muscle activity in the intestinal area there. Water, though, is going to be very important with our fiber. If we have tons of fiber and not enough water, it's going to plug us up even more. So we want to make sure fiber and water work hand in hand. We're drinking enough to keep our stool nice and soft so it can flow through. It's not uncommon if your child has a neuromuscular condition that you need to also use some sort of laxative or bowel care regimen. And these are safe to use every day. So this is something you can talk with to your care team if we're having struggles with bowel movements and we've really optimized our nutrition opportunities. We can do some bowel care regimen and set up some sort of system to help get that bowel movement going. You might still have a child that's still eating by mouth and struggling with some of these high fiber foods where they don't want to eat it. There are fiber supplements out there too that we can use as an option to help keep that bulk in there and keep those bowel movements going. Now, our fluid needs are going to be very different for everybody. It's very individualized. It can be based on age, body weight, especially for our growing kids and our younger pediatric kids. We might have higher increased needs depending on the condition. For some of our kids with neuromuscular issues, they might not have the strength to get rid of some of the secretions that they have. We might have extra secretions, and oftentimes that means we have extra fluid needs as well. So these things are not uncommon where we have to make sure we're getting enough fluid in our system so that we have that right balance. And of course, we don't want too much because that could strain the heart. So we want to find the balance. Again, with nutrition, everything is about not having too much, not having too little. So we want to find that good balance in there. Some of the options for our fluids, yes, water is the best option. So we want to try to limit sugary beverages. Even if your child needs to eat a little more, those sugary beverages can actually stifle the appetite. So we want to limit that as much as we can. We can flavor our water as much as we want. That's a-okay. And there's a lot of sparkling, bubbly waters out there that you can flavor. So it can give a better feel for it if we're still eating by mouth. If we're doing our enteral nutrition, if we have a G tube or we have an NG tube, this is a great opportunity to stay hydrated. I have many children that they've been able to eat by mouth, but drinking is just a challenge to get that nutrition in there. So we can give some water boluses to make sure they're getting enough fluids that way. And of course, our calcium fortified beverages are a fluid option as well. So this counts towards the fluid that we're taking in. And last but not least is our bone health. This is a big focus when we are making sure that our neuromuscular kids are staying well nourished and healthy. So the bone building minerals and nutrients that we're looking for, there are many of them. We are paying attention to magnesium, vitamin K, phosphorus. We want to know that we are getting everything that we need. Now, calcium and vitamin D are big tickets right there. We are going to check and do at least annually a DEXA scan. If your child is non-ambulatory, we want to make sure that our bones aren't too weak where we're at risk for fracture, if there's any falls, anything like that, we want to make sure that your bones are nice and strong. Your dietitian is going to make sure that you're getting enough calcium intake. We want to check to make sure that you have everything that you need. The dietary reference intakes vary by age. Our 4 to 8 year young children need about 1,000 milligrams a day, and that's probably about 3 servings of our dairy. We need, for 9 and older, 1,300 milligrams of calcium every day. So we cover those bases with about 4 servings of our dairy foods or fortified non-dairy substitutes. Now, dairy is most well known, but of course it doesn't have to be what we're going to be eating. But you can see we have much higher amounts of calcium available per serving compared to some other foods that carry our calcium with what we're going to be eating and how much calcium comes with it. Now, if your child's not eating any of these foods, what do? We can certainly supplement here, and this is where supplementation can be appropriate. This is something where I've had discussions with my children. Would you rather drink a cup of milk, or would you rather chew on your calcium supplement? And they get to make the choice here. So a lot of the calcium comes in 500 to 600 milligram supplemental forms. Your best bet, you want to spread your calcium out throughout the day to really optimize that absorption of the calcium. So with every meal, if we have some sort of calcium-rich food, that's great. If you are going to take a supplement because we're not meeting all those servings of calcium, have that at separate times from a dairy source, for example, so that we don't take all the calcium in at once. We're spreading it out to really help absorb it the best. But you can see there's lots of different food options that we have, and those supplements can be fairly tasty. There's some that I compare to Starburst. There's other supplements that are chocolate flavored. There's some that are on the more chalky side. So really, whichever one your child will be willing to take and eat. A lot of children will get sick of one and want to switch over to something else. That's absolutely fine, as long as we are meeting our mark and getting our calcium either through food or supplemental form, so that we can make sure those bones are getting the best that they need. Now, vitamin D is another very important nutrient. This is something that actually, when activated in our body, acts like a coach. And so with this is going to be very important to make sure we have enough. The DRI is about 600 international units, or 15 micrograms daily, but it's not uncommon to see our neuromuscular kids needing more. It is fortified in many different food sources. We check our children annually to see what their vitamin D levels look like. If they are going to be in need of supplementation because lab levels are low, it's actually one of the easiest supplements to take. You can get it in liquid form or chewable. Doesn't taste like anything. So kids rarely give any pushback when it comes to taking this as a supplement. Well, thank you all very much. Does anyone have any questions?
Awesome. Well, thank you so much, Kelly, for that amazing presentation. I'm just going to open the floor up now to any Q&A. So do feel free to type into the Q&A chat box, and I'll just give it a minute or two to wait for a question coming in. Alrighty, so I don't see any questions coming up, but this, just as a reminder, again, this will be recorded and is going to be posted on the mda.org website. So if you do have a question about the presentation going forward, you can email mdaengage@mdausa.org. I just want to say thank you again, Kelly, for your amazing presentation, and thank you so much for all you do for the neuromuscular community.
Thank you as well. I hope you all have a wonderful day.